JBI has its own approach to qualitative evidence synthesis, and it's referred to as meta-aggregation. This approach has been around for, I think, about over 20 years, and hundreds of people have used the approach for synthesising qualitative studies. And so it was just timely to do a review of our guidance for that. So we have spent, the JBI Qualitative Methodology Group has spent an extensive amount of time reviewing our guidance and making sure that it's up to date, clearly describes and provides enough detail for reviewers to be able to undertake the process of meta-aggregation. So the whole chapter has been completely rewritten. Reviewers will see that there are some new sections and that we have also provided more detailed guidance in some of the familiar sections that were there before. So in terms of what's new, we have really tried to give people an understanding of, a deeper level of understanding of meta-aggregation. And so there is a new section around the theoretical underpinnings. Meta-aggregation is informed by pragmatism and transcendental phenomenology, and so people will be able to read about how both those approaches provide a robust framework for synthesising qualitative evidence. There's another new section in the chapter dedicated to reflexivity. Reflexivity is an extremely important in conducting primary qualitative research, and it's just as important when conducting evidence synthesis as well. So what we recommend for reviewers is for them to adopt a reflexive approach when they're conducting their review and include a reflection statement, and we provide some guidance on how they can do this. So there's also a new section titled Equity, Diversity and Inclusion. The methodology group has conducted research around how EDI needs to be considered within qualitative evidence synthesis, and so reviewers will be able to see some of the considerations that they can think about when they're conducting their own qualitative synthesis research project. So what reviewers will find in this chapter is more detailed guidance, enhanced explanations and lots more examples to help them conduct a qualitative evidence synthesis using meta-aggregation. In healthcare, where there are a range of different types of questions that clinicians and policymakers ask, some of those questions relate to how well an intervention might work, whether it might be feasible to use a particular intervention in a particular setting. But what is just as important is how people feel and experience healthcare. And so qualitative research and qualitative evidence synthesis helps us develop a deeper understanding of that and provides a more collective, comprehensive picture of how we can best deliver healthcare.